So this is a small hospital in Haiti, uh, in Milot, and it has been operational for last 40 years. And as we know, the economic situation in Haiti is really bad, and still it addresses more than 500 visits every day. This implementation, this journey with Haiti uh, HSC has been for last 5 years, and with Ozone, we were able to address all the requirements, all the features that were required by HSC and requested by HSC. Before starting, I would like to share what Ozone is. Ozone is a platform which allows applications to talk to each other, and it helps to answer all the HIS needs that a facility might have. So Ozone comes out with some default application. We have default applications. We have a catalog of applications which Ozone supports. We have an ERP system. We have an LIM system, a PAC system. We have analytics out of the box. So yeah, this is what Ozone is. So now let me proceed with how the journey started. So it started back in 2020 when HSC was looking for a stock management and an administration system. So this is the very first requirement that most facilities are worried about and do ask. So in 2020, we started implementing Odoo for HSC. This was the first step where Odoo was implemented. As we know that Odoo is the enterprise grade level ERP system. So we helped HSC implement that. Soon after, okay, so we have a screenshot here of how Odoo looks and how the integration of HSC with Odoo looked. So there were a lot of complaints of theft, of money lost. So they were trying to address that with the ERP system. So Odoo helped them answer all those problems. Right next in 2021, there was an requirement of an EMR. So we did a pilot with Bamni and with only one department, pediatrics department. And soon we were able to scale it from a single department to 15 departments, which were mostly all the departments in HSC. And this was a pilot, and soon there were more requirements to add IPD and support for single sign-on. It's when we decided to shift and leverage the Ozone capabilities of switching and selecting, picking and selecting the applications which the facility really needs. So we switched from Bamni to OpenMRS O3. O3 comes out with a WARD app, SSO. SSO and role-based access was a part of Ozone ecosystem, so it was really easy for us to implement that. Even the migration was simple enough for us to do because we were in a process of writing a couple of scripts which we plan to soon open source and help so that people can use those scripts to migrate from Bamni to O3. Also, everything was fully translated into French, such as allergies, immunizations, and a lot more things. I think I have attached a couple of screenshots as well to showcase that. So this is a Keycloak single sign-on page. So what happens is you just need to sign on in a single application once, and you will be logged into all the applications across. So may it be Odoo, may it be OpenMRS. So you just have to sign in once and you will be logged in. This is a screenshot of how the O3 version looks for HSC. As we can see, most of the things here are already translated into French. Moving on, we also added the IPD functionality, which we were just before the presentation talking about. Some folks from PIH, I think, were showcasing this. We implemented this for HSC. Even this is completely translated into French, as we can see. Even this was not all. Ozone comes with a lot of applications, a lot of tooling around it, which is analytics, which is backup and restore, monitoring. So all this comes out of the box when an implementation decides to go with Ozone. Right now, I think we have already discussed with HSC people, and they are interested in implementing packs and limbs. This would be relatively very easy to integrate with the existing infrastructure that Ozone comes with, because all the integration routes, all the talking of one application to another with the EIP technology which Ozone brings is very easy to implement. Yeah, so I think next are some screenshots of Snate. So this is how the Snate looks. Also, all these applications, all these tools are completely open sourced. Even Ozone is completely open source, so anybody can give it a try, give it a shot, and see how it fits in their use case. So this is Snate. We can see uh, how these samples are listed. So this is a enterprise grade LIMS system again. You can create patients which are clients in a LIMS. You can have analysis requests here. Having said that, this is completely integrated with OpenMRS. So whenever if anybody will order a drug order or a laboratory order, that will automatically sync in here. All the laboratory stuff can happen here. Adding the results, creating partitions, publishing the results will happen from Snate, and that will probably go back to OpenMRS result viewer. So this happens via the EIP layer that we have with Ozone. Moving forward, we have integrated uh, Superset as the analytics visualizing platform. So this just doesn't give the clinical view, but also the billing inventory view. Also, this is connected to all the databases that we have in the system. For example, with HSC, we have the clinical data stored in OpenMRS and the stock management data, inventory data in Odoo. So our Ozone Analytics connects to this database, both these databases, and fetches all the data and visualizes on this superset, which also comes out of the box from Ozone. Then we have this pack system, which is a part of Ozone again. And more on this, I think we have a lightning talk tomorrow. So we'll definitely love to discuss more on how this pack system integrates with the OpenMRS flows. Yeah, I think this was it. We would encourage you to read more on these case studies like HSC with Ozone on our official website. Uh, yeah, thank you.